As always, please remember to keep yourself on mute and turn your video off. Additionally, we will be loading this presentation and the slide deck to our Strong Start library by this afternoon or early tomorrow morning. So make sure you look for all the information there. So Ken, I'm going to turn it over to you. I think you're on mute, Ken.
Yep, good afternoon, everyone. Thank you for joining our afternoon office hours. What we'll do this afternoon is, as we do every week, we will take your questions. We'd ask that you submit those through the chat feature. I will reconcile those questions, and then I will pitch those to our individuals that are participating today. We have on the call today 4 items that we're going to discuss. We're going to provide an update on the Phase 3 information for school systems relative to band and vocal music. We're going to touch on the athletic guidance forthcoming from the LHSAA. Dr. Finger will lead us in a discussion on playground equipment cleaning, and then we'll get an update on the Children's Hall, New Orleans Town Hall updates. But before I move into it, Meredith, what I'm going to do at this time, I know we have Dr. Brumley who is on the line. So what we'll do is I'm going to let him say a few words, and then I'll let Dr. Welch say a few words, and then we'll go into the presentation.
Thanks, Mr. Bradford. Looking forward to being a participant on the call today. Certainly appreciate all the work that's happening throughout our great state to provide kids a strong education in unprecedented times. Do want to do a plug for system leaders that are on this present call, that tomorrow at 9 a.m. we will have our reopening roundtable.
Thank you. And I see Dr. Welch is on the line with us today. So Dr. Welch, if you wouldn't mind just giving us a quick overview of where we are on the status of COVID-19 in the state of Louisiana.
Absolutely, Ken. So fortunately, I'm going to report some moderately good news. The good news is across the state of Louisiana, we are seeing a declining number of cases. We're seeing a slight decline in the number of hospitalizations and a slight decline in the number of deaths. So I really do believe that the interventions that people across Louisiana are continuing to implement really are working. The downside to that is I just wish the overall levels were a lot less. Again, to say we're decreasing from a large number is harder for me to say that we're decreasing from a low number. So I think we still have a ways to go, Ken. However, I will say that all the numbers are starting to look good and going in the right direction. So I just want to congratulate and again say how proud I am of the school system involvement, how dedicated you all had been to sort of the simple 4 or 5 rules that we put in place. And just know that the Office of Public Health is continuing to monitor, continue to work with your regional medical director and our partners at Children's Hospital and Ochsner Hospital to make sure that we find those cases, that we isolate them, that we quarantine close contacts, because it seems like we're going in the right direction and those activities are working. Thanks, Ken.
Thank you. All right, Meredith, let's go into the next slides. So just to give you a little background and context, we've been working diligently here for the last almost week now on band and vocal music. And we had released our guidance document to the field. We released it. And it outlined how you could do band and vocal music through Phase 3. When we went through the gate into Phase 3 last Thursday, when the governor made the proclamation for that, he also indicated that there would be additional information forthcoming the following day on Friday. Friday afternoon, opensafely.la.gov updated all of their Phase 3 documents. Part of the recommendation in there in the Phase 3 was very specific about singing and playing band instruments indoor with some very strict limitations. We were able to work with Dr. Welch from the Office of Public Health over the weekend, with Dr. Bu and Dr. Guidry into Monday. And what we were able to do was get to a place where we could identify some flexibilities that would allow you that opportunity for your students to continue their band classes throughout the fall semester. And as it has been all along, our top focus is the health and safety of students and employees. As we support the systems in your efforts to reopen and operate the schools, we're going to continue to monitor the pandemic and address any of the necessary regulatory flexibilities to support school systems and the instructional needs. So let's take a look at what those current guidelines are. So when we worked with the Department of Health, the recommendation is that band and vocal music activity be held outdoors to the greatest extent possible in phase 3. Should those activities have to come inside, for example, like the weather, and you're unable to do that class and that practice outside, then you can hold your class inside, but it must be in accordance with the National Federation of State High School Associations and the National Association for Music Education Guidance. And so there's guidance out there. This is a document, it's about 22 pages of guidance. And it has in it how to physically distance, how to mask, how to have your instrument coverings. And so there's a set of provisions for doing band indoor that, should the conditions require that you have your band class inside, that you could do those. I'd also note that while we're in phase 3, string and percussion instruments where there's not blowing, as long as there's social distancing between band members, that can occur throughout all of the phases. And what we are going to do is, we have linked on the previous slide, we have a link to our FAQ. It was updated as of 8:25 this morning. You can click on that and read this guidance. You can also click on our guidelines document where we have all the tables about the phases. It's embedded in that document. And then we'll have this PowerPoint presentation. We'll put this up later this evening for you. You'll have the link here where you can go to these guidelines that have been established by the National Music Education Association for having band inside. So this is where we are on the band and the vocal music updates. So Meredith, let's go to our next update. Our next update today is around athletics. And I've been in discussions with Mr. Bonine this week, talked with him this morning, and they are releasing athletic guidance, general guidelines for fall sports competitions. They're releasing a memorandum this afternoon. It is going out to the member school principals, athletic directors, parish athletic directors, superintendents, and LHSAA officials. It's relative to the guidelines for cross country, football, swimming, and volleyball. Also in these guidelines that will come out, because I just said that we've been having some questions about cheer and dance and band, and how do those relate to the football games when there's a game being played. Those items are addressed in the general guidelines that are being released and shared with school systems this afternoon from the LHSAA. So you'll be able to go to that document and look at that there. Also, what is addressed, we've had questions about seating capacity right now in the open safely for outdoor amateur athletic events. It's 25% for fixed seating capacity. So again, those are the type of things that will be in that LHSAA guidance. So if you're having a football game and you're trying to figure out how do you configure your seating, you'll go there for that particular set of guidance. Okay, at this time, Dr. Finger, if you're on, if you can unmute yourself, and if you can take us through the playground equipment cleaning update.
Thank you, Ken, for that introduction. I think this is a slight modification of what was previously posted, but really takes the language from the CDC guidelines and makes it, I think, operational in an effective manner. So as you guys have created your checklist over the last several weeks, I think you do the same thing for the playground. and have that checklist available when you are doing the cleaning. And it should be done similar to what you do with frequently touched surfaces inside. I think ideally it should be cleaned at least once a day, and then more frequently during the day as allowed. The translation operationally does not mean that it has to be used every single time a class cohort goes outside. I think that is operationally incredibly challenging. And as we work here, we want to really maximize bang for buck. And I think as I've reviewed this with medical leaders from across the country, I think that might be very onerous and sort of distract the educator team from other more high yield activities. And then again, after wiping the surfaces, they should dry for 30 seconds. At this point of time in the state of Louisiana, that means it's taking about 20 to 30 seconds for that to dry. And then the biggest thing that I would encourage as students go out onto the playground is there should be hand hygiene done upon entry to the playground and hand hygiene done after the playground is used. And I think almost more, I would put that up as number one. That's a big, big deal as we let kids onto and take them off of the playground. Meredith, I know you guys have gotten some questions about this. Anything more specific that you'd like me to address now?
No, I think that about covers it. We appreciate your partnership as we work to make our guidelines operational. So we are super thankful for you finding ways that we can open our playground equipment for our students in a safe manner.
All right, thanks, Ken.
Thank you, Dr. Finger. Okay, next, while we still have our Children's Hospital New Orleans partners on the call, I'll let them speak briefly to the hotline and the upcoming town hall series that was rescheduled. So Kim or Dr. Finger, if you're on, if you could tell us about these opportunities.
Hi, everyone. This is Kimberly Buckingham at Children's Hospital. Thank you, Ken, for giving us an opportunity to review some of our resources. Just want to remind everyone on the call, as usual, that we have our school wellness and virtual care hotline available to all schools anytime that they need guidance relating to a single individual demonstrating potential COVID-19 symptoms. That number is 504-837-7760. And additional services beyond COVID-19 guidance available through that hotline are return to school screening, enrollment in at-home symptom monitoring services. We can facilitate a visit with a physician. And in the greater New Orleans area as well, we can also schedule testing. So please don't hesitate to reach out and use that phone line as your easy button. Additionally, we have a town hall series that is continuing throughout the month of September, and that is begins at 3 p.m. every other Tuesday. I will make note that we had to reschedule this week's town hall due to what we thought was going to be a hurricane in the New Orleans area. So next Tuesday, beginning September 22nd, we actually have, that will be 3:30 to 4:30. That will be a unique time, so please make note that's 3:30 to 4:30. And then September 29th, it will be from 3 to 4 p.m. Topics will cover issues that have and questions that have continued to pop up as schools reopen. So we're continuing to leave that open-ended, and we'll continue to review scenarios. So please tune in, and we'll continue to post those on our website for your reference afterwards. And if you have any feedback for topics that we could cover during those sessions, please feel free to submit those on our website through our online FAQ submission form, or you can send us an email at school-wellness@lcmchealth.org. So thank you, everyone, and we appreciate all of the work that you're doing and continue to feel honored to support you in this process. Thanks, Ken.
Thank you, Kim. Okay, let's go into the Q&A section now. I told you we had a short agenda today, but we did have 3 very important items. So the first is, Dr. Welch, first question we have today is for you. And that is, if we're being asked if you can give us any updates on when a vaccine becomes available. Will our teachers in the state who are, part of this critical infrastructure, will there be priority, will they be given priority status and have that opportunity to get those vaccines in an early phase of the vaccine administrations?
Well, Ken, first off, I'd like to say that you're talking to the right guy, because I am actually leading the state's response, the vaccination response. And we are going to follow federal guidance. As many of you know, when a vaccine comes out, it doesn't come out all at once. There aren't 300 million doses. Usually when the vaccine first comes out, it's in very limited supply. So you have to prioritize people. And we're working with the federal government and our CDC partners. The vaccine will probably roll out over 6 or 7 months. You probably heard that from the CDC director this week. Hopefully we'll get those first doses of vaccine, I'm hoping November or December, and obviously those would be very limited doses. It's going to be a 5-phase campaign, and the first phase is obviously for those frontline healthcare workers treating COVID-19 patients, and also those people in the highest risk group to get COVID, which is nursing home residents and patients. However, in phase 2, it is critical infrastructure workers, and it makes it very, very clear that in this 5-phase campaign that teachers and educators are in group 2A. So they will be in the highest priority group in the vaccination campaign. I don't know exactly when that's going to be, Ken, and I don't know exactly how it's going to roll out, but just know that our educators and teachers, again, are in that highest priority group right after people treating people with coronavirus and people at highest risk in nursing homes.
Thank you for that update. I think that's what they were looking to hear. Next is marching band size. So I will address this one. The marching band size, so when we've moved into phase 3, the group size is 50. Also, we have been reviewing the guidance for a return to high school marching band, which is put out by the National Federation of State High School Associations Music and Sports Medicine Advisory Committee. And in phase 3, they also have a recommendation of 50 individuals. And so the group size has to be 50. Now, the question that we have been asked also is, could you have 100 band members out on the field, but as long as they're separated, could you have 2 groups of 50 on the field? And the answer is yes. We get asked a lot, and I'm gonna package the next part of this question in and then turn it over to Dr. Welch, is with the band members. One, why can't they congregate larger than 50? And then it's I know it's related, because I talked with Dr. Welch about this. It's also related to we're getting questions about if we can go indoors with these precautions in place. Why can't we just go indoors every day? Because isn't it just as safe if we put the slit in the mask? As an example, we put a slit in the mask, or we put the cover on the trombone. So Dr. Welch, could you just give us the confirmation about keeping those groups of 50 separated if they have more than 50? And then secondly, just talk to what do we know about this super spreader, which is kind of leading to some of these limitations in band.
So again, what I want to remind people is back in December when coronavirus started, there wasn't a coronavirus book on the SARS-CoV-2 book on the shelf that we could just take out and know everything about. We are still learning about this virus and how it spreads. And I just want to remind people, remember that yesterday in the United States, more than 1,000 people died of coronavirus. So this is very much still a thing. It has not gone away. And so every day that we learn more, we can refine our recommendations. Limiting the number of people that other people come into contact with is a very effective way of preventing spread or limiting spread of coronavirus. But also remember, the more people we mix together, the more likely it is that if someone comes down with coronavirus, that all of those people will need to be quarantined and monitored. So the small, I see that the group size has gone up to 50, but in cases I wouldn't recommend going up to 50 in every circumstance and thinking, oh, there won't be a consequence if something happens. Just remember that that group size is also set by the state fire marshal. It's recommended in band groups and the guidance that you shared with me today, Ken. So just remember, that limiting the group size just temporarily for right now is going to be an effective way, and it's also going to minimize things if something does bad happen. And then I also wanted to talk a little bit about super spreading events and just not going indoors. That's kind of the fingers crossed and hope everything goes well philosophy. And I would encourage you all to look at past 6 months and look at those situations in the United States where we've crossed our fingers and hoped things were going to go well. And in a lot of those situations, they didn't. And so I'll have to say that of the super spreading events that have happened in the United States, many of them involved choir, band, and you can imagine if there's a virus in your nose and throat, and the louder you speak, the louder you yell, the louder you sing, and the more wind you push out of your mouth, the more likely it is that those people who are asymptomatic are going to spread that disease. Now, how well it can be protected by us singing with a mask over our face or putting a cover over our instruments, we simply don't know. I'd hate to have a few of these events happen and then say, oh, well, we should have known better or we shouldn't have crossed our fingers. So again, what I want to remind people is as we slowly roll out this guidance and slowly allow more and more things to happen, we're also being cautious and monitoring that situation. And if, say, in 2 months or so or a month and a half, we find that there are no events related to this kind of thing, then we'll know then it's safe to go a little bit further. But to sort of open everything up and say everything is normal with our fingers crossed, it has not worked out well for coronavirus prevention so far. So again, I want to remind people that these are temporary measures that we're putting in place during the pandemic before we have sufficient herd immunity with the vaccine rollout. And as we know things are safe, we're going to allow more and more allowances. But until then, we shouldn't just allow things that we don't know are safe, especially when they're associated with these incredibly high-risk activities like playing a wind instrument or singing. We really want you to be cautious with those things because we know that those can super spread the virus.
Thank you, Dr. Welch. Next question is if you could speak to, is there any recommendations about using ultraviolet light sanitizer wands?
Yeah, and so Ken, these are kind of popular now because we have found out that ultraviolet light does kill coronavirus. And that's why it's so much safer outdoors as well. Not only is there fresh air and harder to come into contact with coronavirus, but sunlight actually kills it. However, just remember that what you're doing with a sanitizer wand is you might be minimizing the effect of coronavirus on a hard surface or on but you're not actually sanitizing the person who put it there. The greatest way to spread coronavirus is to come into contact with someone who actively has coronavirus, not coming into contact with the surface. So although I will say that, yeah, a UV sanitizing wand would probably kill coronavirus on a surface, it's not going to do anything to the person who is sitting next to you spreading coronavirus. So that would definitely be a secondary or third-rate strategy versus simply wearing a mask. That is absolutely the best strategy we have.
Thank you. We have a question about the cheerleaders and the band and dance teams as it relates to a Friday night football game. And I'll just say that is going to be guidance, which is coming from the High School Athletic Association, who has been working with all of the stakeholders. And then they will be outlining in there, who are the essential personnel and the players. And then they will help, they'll have some guidelines in there around if you have an oval track, if you don't have an oval track, how to configure, and then which individuals are counting in the 25%. of the total versus those that are actually essential and are players. So I would recommend, again, for those individuals on the call that you reach out to your principals, your athletic directors, and your superintendents and your head coaches of cross country, football, swimming, and volleyball, who have all received this afternoon the LHSAA general guidelines for fall sport competitions. That's where you'll find that information in there, as well as the information about the cheerleaders, etc. Next question, Dr. Welch, is, it says here, if a household member has symptoms and gets tested, does the entire household need to quarantine while waiting on results for that one person? Or is it just the person who is tested while they wait for their results? And I would just plug, before you answer that, Dr. Welch, that we have Dr. Finger on and Kim, our partners at Children's Hospital. They've made some great diagrams, as well as you, Dr. Welch. You've put together for us some school scenarios that are all on our resources on our Strong Start webpage, on the department page. But if you wouldn't mind just giving us the quick answer on that, about if a household member has symptoms and gets tested, does the entire household need to quarantine while waiting for results?
Yeah, Ken, I'm going to follow my chain of command and pass that one to Dr. Finger with the hospital.
Yeah, thank you, Ken and Dr. Welch. I think there's not a one size fits all necessarily, so it's a little bit of a hedge, but not really. At this point in time, we're not recommending that everyone quarantines in the household while waiting for that test. That being said, back in the end of March in New Orleans, what I would have recommended had someone gotten a test would be that, yes, it might be effective for that entire household to quarantine, because the likelihood of a positive test back then was much greater than it is now, with our local percent positivity rate around 2 to 2.5%. Also, what I would say is that if a child does have any symptoms and there's an adult in the household or someone who has a test pending, that person should definitely be quarantined, and I would investigate whether or not that child needs to be tested or see their primary care provider. So I recognize that's a little bit of a hedge, but I think we do need to have a little bit of flexibility in how we interpret that over the next couple of weeks and months as our prevalence rates change across the entire state. I suspect that matches what Dr. Welch and his regional medical directors across the state are recommending as well.
Thank you, Dr. Finger. Dr. Welch, I want to come back to the sanitizing wand again, and just for clarity. It was asked, could this be used to clean tools? And so I know, I think where this is going is there are some instructors at career centers, where they may be doing welding and carpentry and as such. Is this something that could be used to sanitize tools, do you think?
Sure, if you wanted to go in that direction, but Ken, remember that this virus, another thing we've learned is it's very easily cleaned and killed by ordinary cleaning agents. And so, just having a Clorox wipe or a cleaning wipe to wipe the tools, you would absolutely, you can imagine a cleaning wand probably would be more difficult than wiping it off with a Clorox wipe. So you probably could do that, but I know the Clorox wipe works if you wipe the entire tools. Okay.
I've got another one coming into me, and that is relative to a high school classroom. And this, Dr. Finger, this may come to you. If a student tests positive or is COVID symptomatic, do all students who have been within 6 feet of that student for 15 minutes or more need to quarantine for 14 days?
Okay, so let's take the example where the child just has symptoms. At this point in time, if there is a plausible alternative diagnosis, which for every child under the age of 18 there is, and we are seeing currently across the entire state higher rates of other viruses than COVID-19, we would not automatically quarantine the children who were within 6 feet of that child if there was not if there were just symptoms and not a documented positive test. okay? That might change again as disease prevalence changes in the upcoming weeks and months, i.e., go back to my other example, if we have local prevalence in New Orleans of 30 to 40% positivity and someone has symptoms consistent with COVID-19, then Dr. Welch's local regional medical director might say, hey, we need to treat this as a positive because it's a 50-50 chance that the kid's positive. But right now, that would not be the case. The next scenario is if a student is positive for COVID-19, what the contact tracing team would do would say, okay, kid is positive on Wednesday. Who was the child within 6 feet of for more than 15 minutes on Monday and Tuesday during school, and sort of go through the entire school day on that campus. And that's irrespective of whether children and teachers are wearing masks. And those students who are deemed to be close contacts on Monday and Tuesday would then be excluded for a full 14 days. And they could follow our algorithm on whether or not they needed to be tested. The vast majority of those close contacts do not need to be tested during that 2-week period unless they develop symptoms consistent with COVID-19. If they do get tested and they have a negative test, it does not mean they get to come back to school sooner than 14 days. They remain out for the full 14-day duration on quarantine.
While we're on the topic, Dr. Finger, can you also clarify, is close contact only in a single setting, or is it a cumulative effect over time?
So the by the book answer is that it's in a single setting. However, the regional medical director's team would like to hear about these cases, but because there can be some considerations that cumulative time might be important and contribute to an amplified or an increased number of close contacts, i.e., if there's a coach in a gym going from groups of students to groups of students and they spend 5 minutes with each group of student or something like that, over time, it would be more than 15 minutes with each group. You might want to, count all of those students as a close contact if someone has the disease. So there's a lot of different examples sort of like that, which is why each scenario does require the school representative to dialogue directly with a member of the regional medical director's team to discuss the specific nuances of that case. And again, we're not making it intentionally complex, but we want to be able to empower the local school leadership to help make the correct decisions, to embrace the safety of the children on the campuses, as well as the safety of all the educator teams.
Great, thank you for the answer. The next one, Doctor, we just have two questions left. One for you and one for me, Dr. Welch. So the one for you is, when students in phase 3 go outdoors for their choir class, do they still have to wear their face mask if they are 6 feet apart?
So according to the governor's mask order, no, they do not. As long as they're physical distancing and outside, they do not have to wear their mask. However, obviously, as a public health official, I want to recommend that they always do so when it's convenient for them. But if they're outside, outdoors, and more than 6 feet apart from each other, they do not need to wear the mask.
Great, thank you. And the last question today is for me is will today's questions and answers be available? And the answer to that is yes. We'll have 3 deliverables coming out from this. One is the video. We're recording it today. We will take this recording and we will post it online on our Strong Start page. We will also provide today's PowerPoint with the embedded links in there on our Strong Start page, and the FAQs for questions. Some of these questions today we've answered before, they're already in the FAQ, but for new questions that came up today, we will take those, transcribe them, and put them into the FAQ document. Hopefully we'll have that done for you by close of business tomorrow, all 3 of those, and have those ready. And with that, Dr. Welch and Dr. Finger and Dr. Brumley, that brings us to the conclusion of today's call. So if y'all have any closing comments, I'll give you the floor now to provide closing remarks, and then we'll be able to end today's meeting.
I have nothing else to add. Thank you, Ken. Thank you, Dr. Welch.
Thank you, Dr. Finger. Dr. Welch, anything?
Nothing else from me. Thank you, Ken.
Thank you. And I think Dr. Brumley has went to another meeting, so we'll bring closure to today's meeting. Thank you, everybody, for joining. Look forward to seeing you next week.